All right, good morning, everyone. We're going to determine a quorum and call this meeting to order. In order to do that, all fellow board members. Okay, in order to do that, all fellow board members, I will call your name if you will please say here. Ken Smith.
Here.
Don Hall.
Here.
Brad George.
Here.
Beth Burns. Here. And myself, Cindy Fontana. Okay, we can now call this meeting to order. At this time, I need a motion made by someone who will approve approval of the agenda.
I make a motion to approve the agenda as presented.
Ms. Burns has made the motion that we approve the agenda as presented. Do we have a second?
Don, second.
Mr. Hall has seconded. All in favor, once again, I'll call your name. Mr. George?
Yes.
Mr. Smith?
Yes.
Ms. Burns?
Yes.
Mr. Hall?
Yes.
Try this again. We're back.
Okay. All right. Thank you. At this time, we need to have a motion made to go into closed session. Which board member would like to make that motion?
Pender County Board of Education will enter closed session subject to the advice from the attorney pursuant to North Carolina General Statute 143, 318, 11A1 and A6 to prevent the disclosure of confidential personnel information under General Statute 115C-319 and to consider matters relating to initial employment of the individual employed. Board will also go into closed session pursuant to General Statute 143-318, 11A3 to consult with the board's attorney in order to preserve the attorney-client privilege to consider confidential student matters. That's provided in North Carolina General Statute 143-318 and the Family Education Rights and Privacy Act 20 U.S.C.G. 1232G and North Carolina General Statute 115C-402.
All right. Thank you, Mr. George. Mr. George has made the motion. Do we have a second?
I'll second.
Ms. Burns is seconded. All in favor, I'll once again call your name. Mr. Hall?
Yes.
Mr. Smith?
Yes.
Mr. George?
Yes.
Ms. Burns?
Yes.
All right. So moved. At this time, we are now moving into closed session. we are now coming open session. At this time, we're moving into the informational part of our agenda. And Dr. Blumenreich, I believe you're going to start this part.
Yes, ma'am, thank you. So I've just shared with everyone the item of the school-based cases. And so in looking at the dashboard, kind of looking with our personnel, we tried to extract what we were able to determine to be community-based or home-based and just look at our school-based processes in terms of confirmed positives and quarantined due to exposure from last week. And so ran the numbers from a standpoint of a Sunday to Saturday, so that way that gives us the spread of the full week, although everything that is school-based we're able to determine falls in the Monday to Friday range. And so if all the board members have it, in a nutshell, when we extract out everything, our current school-based totals of confirmed positives are 35 for last week, and quarantined due to exposures at 246. Now, there's a couple caveats to be aware of regarding that, and that is the main one, that it's just school-based that we're able to determine to the best of our ability, or the nurse's ability. The second thing is that is over the span, over the range of the week. So, for example, if somebody is currently quarantined on Monday, they get counted in the total even if they come off at the end of the day. Now, we can do a much more refined filtering process if you would like, but we just kind of count everybody. It's the kind of a kitchen sink phenomenon. So everybody should have that PDF, and in terms of next steps, we can follow through with just the school-based reporting, which was suggested, of course, or we can do something more refined, but ultimately that'll be a decision that all of you kind of want to move forward with. So Shirley and Carolyn, you heard those numbers, correct? For the current school-based positives and quarantine.
Yeah.
So that's kind of what we have. So that changes things a little bit in terms of the overall metric.
Well, from what I'm calculating then, for every case, you're having about 6 exposures related to it.
Currently, yes, but again, that's a total number, and some may come off over the course
Correct.
of the week.
Right. Well, that would be the case regardless of what day you picked.
Absolutely.
Is it my turn? The health department's turn?
Yeah, just a second. Well, hold up. You go ahead.
Just for clarification on this chart that you sent out, Dr. B,
Yes, sir.
we have, say, looking at Burgaw Middle School, we have 5 exposures and no confirmed positives.
Correct.
The question's going to be, how's that? So we need to be able to explain that. The other one is at South Topsail Elementary, we have 1 positive and 23 exposures. We sold the mask thing on the premise that we were going to reduce quarantines with pretty much one-on-one. That doesn't seem to be the case there. So can you explain some of these high number of exposures against the low number of positives?
Right. And that is a good question. So again, I go back to the kind of time range. So let's say we have an exposure that may have occurred over the weekend. It may be that it's determined to be a school-based exposure, even though originally it may have been home-based. The nurses are working really hard to really try to refine those, and somebody may end up being determined to have been exposed when they're at the school, so it may be attributable to that. And then, of course, the sports numbers. Then, of course, always, if they're currently quarantined, but they may come off, of course, during the course of the week. So it kind of adds those total numbers in. And so the numbers may be slightly inflated because of the date range. I don't know if that makes sense.
So Brandon, can you explain what the district responsibility is reporting numbers according to general statute?
Sure. So board, you have an obligation to report communicable diseases to the health department by law. Now I could get into the nitty gritty here, but the gist of that is you have a duty / obligation under state law to report the spread of communicable diseases inside of the school setting. Now, outside of the school setting, that is purely the purview of the health department and the responsibility of them as a arm of the state, if you will. In addition to that, under Senate Bill 654, there's some COVID-specific restrictions to talk about quickly related to what has to happen whenever there is a decision for a classroom to move to remote instruction or a school to move to remote instruction. There's a reporting requirement that you have to report to the DPI, which there's an online form to do, sharing the data which led you to move a school or a class or a grade level to remote instruction. That the purpose of that is to have the oversight from DPI to see and understand whenever a school is going to remote instruction. And hold on really quick. Mr. George, does that answer your question, or would you like me to get more specific?
That answers my question. We have no obligation to report outside of school exposure. Or quarantines. That's correct?
That is absolutely correct, sir.
Board, any other questions concerning any of that so far? All right. Carolyn and Shirley, I guess you guys are up now.
Okay, it's gone, as far as county's concerned, it's gone from bad to worse, with our numbers. And, our positivity rate for the county is 18.4, the state's 11.7. We have the fifth worst positivity rate in the state right now. We're really concerned about the fallout come with the Labor Day, which will show up the next 10 or 14 days. We have 14 Pender residents in the hospital right now, and we've had 12 deaths in the last 5 weeks. The hospital in itself has had 21 deaths in the last 3 days. So there's not a lot of kids, 12 to 17, that have been vaccinated. So you have a lot of kids that are susceptible to getting sick. I do think, aside from sports activities, a lot of the kids are they're getting sick outside of school time. And that just indicates really that because of wearing masks, they aren't catching it at school. They're catching it after school, except for sports. So you all, according to some of the information that I've seen, have had 278 either symptoms, exposures, or diagnosis since the 23rd of August. 50 of those have been staff. I just think that right now, if you were to go without mask, you're probably looking at even twice that number. I wouldn't be surprised, which certainly takes a lot of teachers and staff out of the classroom and also sends a lot more kids home, which means parents are out of work. A lot of things to consider, but we are seeing quite a few breakthrough cases right now. Those individual symptoms have not been as bad, but the majority of the people in the hospital are unvaccinated right now. We're averaging about 50 new cases a day. This past week, we had 63 new cases a day. So our numbers countywide are not improving right now. And I don't know what else I can share with you. Really like to have something positive to say, but I don't right now with COVID.
So, Carolyn and Shirley, I guess my question is, I think we still have about, Mr. George, you've done a pretty good job keeping up with this. How many districts do we still have in the state that are optional? 6?
We have 6.
Okay. Carolyn, I'm just curious if you and Shirley have had a chance to look. I know you guys talk to each other among counties, among districts, to other health departments. Do you know, like, what their rate of quarantines and our exposures and all that is right now compared to those of us that are masked up right now?
No, I really don't. That's school data that we really wouldn't have access to. I can only go by what's going on around us, and there are some counties around us that their positivity rates are really high too. But to know that we're this bad without with wearing masks in the schools, I just hate to see what it's going to be without them. But no, we can't compare school data. I don't know if Stephen or Todd or someone could better get those numbers.
Todd, do you have any access to any of that? Have you heard anything?
I will see what I can find. I have not heard anything though.
I was just curious. I just didn't know if you'd heard anything. Okay.
I've got a question for Carolyn as well.
Okay.
Carolyn, as I think a lot of people know, the county commissioners have required masks in all of their buildings in Pender County. Is that something that's been common with the rest of the state too, do you know?
Yes, it has been. There's only a few counties that have gone as far as New Hanover with overall mask mandates. But yes, the majority of the counties have required masks in government buildings, and a lot of them now are moving to required vaccinations for government staff, just like the state.
So what is the rule in Pender County? It was my understanding that they were requiring masks, but or does it depend on vaccination?
It depends on vaccination. If you are vaccinated, you do not have to wear a mask in a county building. But if you are not vaccinated, you do have to wear a mask, with no policing right now of that.
Well, I mean, there's not much way to police it unless you ask for a card, and that's a whole different ballgame.
Right.
So.
We know countywide, our employees that have been vaccinated and those who have not. So it helps us kind of police our departments, if nothing else. You know, you start to look at continuity of operations if you start losing a lot of staff in a certain department and then have to close that department.
Okay, all right, thanks. So, Ms. Mosier, Ms. Steele, the parents are having a hard time. Over the weekend, they had a hard time finding testing facilities that were able to do tests. The times of appointments for testing is a week out. The Strong Schools Toolkit says that the North Carolina Department of Health and Human Services will provide tests for us to do on site. If we were to do that for athletics, especially mostly, who reads those tests? Who administers those tests? And
there were two labs that were, I guess, approved by the state that could help testing in the schools. And I cannot recall the name of that lab for this end of the state, but you could do testing at school. You could do vaccination at school. But, you know, the health department's doing testing. There are pharmacies that are doing testing. Those that are receiving appointments, must be some private providers. And of course, if you have to wait that long, you might as well not be tested. But we're doing our best on this side of the county to offer testing. And then there are a lot of pharmacies on the east side that are testing.
the closest testing facility as of Friday on the east side was today. If you didn't have an appointment by Wednesday, a lot of people when they got the notification on Wednesday that one of our local football teams had been, they swarmed in and took the appointments. If you were after that, the earliest testing was today. At the CVS's, the Walgreens, the Village pharmacies, you have to pay to go to your healthcare provider. They have to do a telehealth conference.
Well, that would have been the same case for the health department if they had wanted to be tested sometime Friday. We might have been able to get them in the morning, but otherwise we would have said to come Monday to be tested. And, in the meantime, they would need to quarantine if they've got that kind of concern about exposure or symptoms. I don't know of counties that are testing in the schools. I can certainly ask around locally and see how it's going. That would help a whole lot, I know, because like you said, primary care providers are charging a visit with it. We would offer testing more often, but we just don't have the staff right now to do it. That is a possibility.
I'm not interested in testing all the students that get exposed to quarantine, but we have these vast numbers of 60 to 80 students that can't find testing facilities. It would be nice if we had an option for them so they could get back to school at a reasonable amount of time. The ones that tested Saturday, that tested negative, they were allowed to go back today according to their paperwork. The ones that couldn't get tested can't go back until they get a test.
There is a website where they can try and find someone that is offering testing, even outside of the county. They can go online and see who else testing, say in New Hanover. So.
Yeah, I know one parent who drove to Cary was the closest one.
You're kidding.
No, it's ridiculous. It's ridiculous that we can't provide that service here in our county more. And I realize you're short-staffed, but it's becoming a burden on everybody.
I understand. It's a burden on my staff right now too.
Well, I'm sure.
Trying to keep up with everybody, and there's a lot of people out there that are sick right now. I think that a lot of people need to remember the 3 W's, though, as far as wearing the mask and the 6 feet and washing their hands, and that says a lot for trying to prevent this and not get in that situation to begin with. Now, granted, a lot of your exposures and cases, it can be among households, and that does make your numbers, go up.
So I have another question for you about contact tracing. Does that have to be a healthcare professional, healthcare person that does the contact tracing? Or could we have Esther's money, that overabundance of it, I think? Is that something we could hire like an admin person to do, work on contact tracing, or how does that work?
Contact tracers, yeah, you can hire some contact tracers. They need to be trained on what to do, but it does not have to be a healthcare worker.
Because our nurses they're overwhelmed, and like I said, when they get a case of 50 or 60 at the time, it may be 4 or 5 days for an actual person that, with any knowledge of what is actually required to get them back in school, contacts them. There's so much misinformation and wrong information, and it's not any one person's fault, but like over the weekend, it was a nightmare at the same school of not knowing what kind of test was accepted. When you have coaches doing the best they can do, and they think they're making the correct information to their players, and sometimes it's not always correct. So I think if we had extra staff, and I know that's a challenge too, but maybe we could pull in extra bus drivers that don't want to make more in between driving buses to help do some of this admin part of it as far as contacting and making sure they have the correct paperwork and know what kind of test is allowed and know a clear date of when their quarantine or exposure or isolation ends. I think it would make everybody's job a little easier and take some of the burden off our school nurses that's staying up to midnight 5 days a week and 10 o'clock at night on Saturday and Sunday.
I agree. You're right. We have used some of the Board of Election workers to help us with a lot of administrative pieces, and that's helped a whole lot. But, yeah, taking on some people that could be trained correctly, I think that could help you a whole lot, and even to the point of them knowing where an individual can go test and the right test to get, just all that basic information. That's a good option.
Carolyn, just so you know, I've also been thinking that with the ESSERS money, due to the fact that we have those funds, we have several schools that share nurses. I know when my personal son was, when he was quarantined, I got a call from a nurse at Pender High who was trying to help out because the school he attends, that school and the school it leads into, they share a nurse. So I don't know how other board members feel, but I really feel like what Brad's talking about, I think that's a great idea. We need to use some of that money to find people who can help trace. And I agree totally. Bus drivers, a lot of bus drivers would love to do something like that and make some extra money. And maybe also we could post to have nurses at each school, the ones that have to share, so we'd have one at each nurse, at least to get us through this. I know ESSER's money isn't a forever pot of money, but at least for through this year and maybe if we go past this year, just something to think about. And I don't know other board members how you feel, but I think Brad's put out something good. I think this is something to think about with nurses. I think that's a conversation we all need to have.
Madam Chair, this is Beth Burns. I totally agree. with having school nurses, with having a nurse at each school, especially right now. I've heard from some school nurses. I know that they are overwhelmed at this point. And I think that anything that we could do to help them we should do it. Also, I believe that's what these ESSER funds are for. I did have a question about the PRC testing. I've been reading. Oh, the PCR testing, excuse me, I'm sorry. I've been reading a little bit about that lately, and apparently on July 21st, there was a lab alert sent out from the CDC about changes to the PCR test. Are you guys going to switch to maybe like a saliva test or something especially for younger students, so they don't have to tolerate the swab going up their nostrils? Has anyone ever considered that? Because especially for these little kids, I would think that if testing could be easier, and we're already, correct me if I'm wrong, but there's been a lot of controversy about the PCR test and whether, exactly how accurate they are. So has anyone from Raleigh said anything to you guys about potentially going with another test?
No, the state epidemiologist has strictly required the types of testing that the state lab directs us to use. And so, no, that discussion has not come up on any call.
Okay, so are saliva tests being allowed?
They are, but they are not acceptable when you're dealing with quarantine and isolation. You have to go back to the PCR test for final. Even the at-home kits or any of those, if they test positive, they still have to come in and get a PCR one way or the other.
Okay, thank you.
Board members, anything else? Mr. Smith? Mr. Hall?
Nope. Nothing. I have something from Brandon, our attorney. Brandon, there's a lot of talk about us requiring medical exemption forms from a licensed medical provider. Can you explain? I know that expired, the mask mandate expired with the last executive order. And this is something that we've instituted. Can you explain to the people listening how we're allowed to do that, or why we're allowed to do that, or why we're doing it?
Sure. I'll do my best to answer all those questions. As most of us know, the last operative executive order that addressed masking expired at the end of July. Now, Executive Order 224 had several pieces to it, and one of the pieces included the effect of local emergency management orders, and it also had a section addressing schools. And so when we talk about the COVID testing and vaccine administration in Section 2 of 224, what that addresses in large part is testing and vaccination, and then there's a specific section about the effect of local emergency management orders. And it basically says that whenever the executive order states that there are limitations, those are minimum requirements, and that local governments can impose greater restrictions, okay? Additionally, inside of this executive order. So that's sort of talking generally about what local governments could do. So, for example, the city of Raleigh passed a mask mandate as a city implementation. That is their purview under this section of Executive Order 224. There is a specific section, it's called Section 3, that has guidelines for private businesses, organizations, and schools. And Executive Order 224 points schools to the Strong Schools NC Public Health Toolkit. Okay, so that's 224. 224, Executive Order 224 expired on July 31st, 2021. However, sections of 224 were extended, and that is Executive Order 229. And Executive Order 229 continues to put in place for the next 90 days Section 2 and Section 3 of Executive Order 224. So the limitations that allow local governments to put in greater restrictions that are in an executive order, and then Section 3, which provides that for schools you should look to the Strong Schools Toolkit, those items are still addressed in an active executive order. Okay, so that sort of addresses the executive orders and how they're currently in play. There's no masking requirement that's currently in place statewide. All masking requirements are local determinations. So when you look at face covering requirements in the school setting, school districts are granted by statute what's known as general grants of authority. And a general grant of authority means that the local board of education is granted a power by state law that allows them to implement whatever they see fit. And so I'm going to read a portion of the statute because I think it's really important for folks to understand that the general grant of power that's been given to local authorities, in fact, has just been returned. So General Statute 115C36 says all powers and duties conferred and imposed by law respecting public schools, which are not expressly conferred or imposed upon other officials, are conferred and imposed upon local boards of education. Okay, so let me translate that. Basically, anything that's not directly given to another state official falls in the hands of a local board of education. So whenever there's no longer a statewide masking mandate from the North Carolina Department of Health and Human Services or the Department of Public Instruction, the return of the power goes back to what the world is like normally, which is local boards of education get to make local decisions. So as far as face covering authority, that's why you've got a divide amongst school districts in North Carolina with some that are requiring face coverings and some that are not. It's because this statute provides local boards of education the authority to make those determinations. And just like those determinations, local boards of education can implement exemptions from those requirements. So just like you have the authority to create a mask covering requirement, you can create exemptions for that requirement. The caveat to put in place is the only real source of information that the state has provided to local schools, and the one that's being highly encouraged by both the General Assembly and the governor's office has been the Strong Schools NC Toolkit. And there are a list of reasons or exemptions for why someone would not be required to wear a face covering in school. And now for a medical exemption, one of the reasons a school district would ask for medical documentation to support a student not being required to wear a face covering at school is because there is lots of incentive in the Strong Schools Toolkit regarding quarantine guidance for wearing masking. So as this board's discussed before, one of the exemptions to quarantining is if both the student who is wearing a mask who has been exposed to someone who tests positive, that student, if they're wearing a mask, and the student who is positive with COVID-19, that student who is exposed does not have to quarantine. So the concept being with that exemption that that student is going to be able to continue to go to school every day. And that's the idea behind the quarantine rule as best I understand. And so if we're going to exempt someone from that requirement to wear a face covering, the medical documentation needs to support that. It seems to be a reasonable requirement that they have a medical provider of some sort, a healthcare provider of some sort, say and justify why they shouldn't be required to wear a face mask, especially if they're claiming that it's a medical issue. The backside of that is also that what if there's an underlying health issue the school district doesn't know about? For example, if a student has severe asthma, there often triggers some federal requirements regarding Section 504 that we may need to put an emergency plan in place for that student to ensure that they are cared for when they are in a school setting. That's one of the examples. There are several others, but that's, Mr. George, I hope that answers your question.
That does. Thank you.
Yes, sir.
Any other questions or concerns from board members regarding what Brandon just said?
Not for those, but I do have some other questions for Brandon.
Okay.
So, Brandon, there is a theory floating around that we are being bought by ESSER's funds. We received $25 million from the federal government. That's why we mandated a mask mandate. Can you please explain what our requirements are for spending ESSER's funds, what they can be spent on and what they can't be, and if we are legally required to offer a mask mandate because we accept them?
Yes, sir, Mr. George. This is pretty easy for me to dispatch with. So ESSER's money is not dependent upon individuals requiring face coverings in school settings. I will tell you that there are school districts that have mask optional. They're getting more ESSER's money than Pender County. There are school districts that are, mask required that are getting more money than Pender County. There's no caveat that would require Pender County or any other school district in the state of North Carolina or the United States to pass a particular mask requirement or face covering requirement in order to receive ESSER's money. So what's required is that the school district develop a plan on how they're going to spend the federal grant dollars, because this is exactly what they is. It is grant money from the federal government and how you're going to spend it. And it's sort of very easy. It's the name ESSER is Elementary and Secondary School Emergency Relief Fund. And so the idea being that these monies are supposed to be used as sub-grants to local school boards to address the impact of COVID-19 in their schools. And there are a list of purposes for which these monies can be used. And Mr. George, if you'll give me 1 second, I can run down that list of purposes very quickly. Or just so you know what I'm doing, I'm going to the law that implements one of the various versions of Esther's money, and I'm reading directly from the law as far as the stated purposes for the money. So it's to coordinate and prepare for the response for efforts from LEAs with state, local, tribal, and territorial public health departments to implement and prevent coronavirus and respond to the coronavirus. Is to provide resources necessary to address the needs of individual schools and principals and other school leaders. Activities to address the unique needs of low-income students, children with disabilities, English learners, racial and ethnic minorities, and students experiencing homelessness and foster care use. To develop and implement procedures and systems to improve the preparation and response efforts of LEAs, training and professional development for staff of the LEAs regarding sanitization and the minimization of the spread of infectious diseases, the purchase of supplies to sanitize and clean a facility of an LEA, including buildings operated by the agency, planning and coordinating during long-term closures if happen to be, including the provision of meals, providing technology, online learning, providing guidance to carry out the requirements of IDEA, which is the statute requiring exceptional children services, how to ensure other educational services can continue to be provided consistent with state, federal, and local requirements, the purchase of educational technology for students who are being served by a local education agency that aids in the regular and substantive educational interaction between students and classroom teachers, mental health services and supports, planning and implementing activities related to summer learning and supplemental after-school programs, and other activities that are necessary to maintain the operation and continuity of service in local educational agencies. Mr. George, those are the 13 reasons why you can use Esther's money.
Thank you, sir.
Yes, sir.
And we have, as a board, to the best of my knowledge, used it for those purposes. We voted on several items that used Esther's money for our virtual learning. I guess we still have a FRP out for our HVAC systems. I had to go back out. But we've, to the best of my knowledge, we have used our funds with what's prescribed in those 13 requirements.
That's exactly right, Mr. George. And frankly, because the way it's been implemented in the state of North Carolina, there's a pretty thorough tracking system from DPI, because that money flows through the state government to you just like other federal funds. So you had to submit a plan on how you were going to spend them, and then as you spend those dollars and as they get sent down from the state to you guys to spend, it's a very well-tracked machine. I'll say that. So.
Thank you, Madam Chair. I don't think I have any more questions at this time.
Any other questions from other board members? All right, so Brandon, I just have two things just to go over, make sure we're doing this right. So basically what I'm hearing, board, and you make sure I'm correct on this, is that we all are in agreement that we would like some of the Esther's money to be used to help with tracing. So we need people to do that, and also to put out vacancies to fill those nursing positions in which we share nurses at school. Brandon, do we have to do anything with that, or can we just be that we all agree that's what needs to happen? Do we have to do anything else with that?
So my recommendation, Madam Chair, is that you've shared that information with the administration. I would have the administration report back to you at your meeting on the 14th about how to best implement those steps moving forward between today and then. That would be my recommendation, and to determine whether or not any action needs to be taken.
Okay. Dr. Hill, Dr. Moore, are you guys good with that for next Tuesday?
Yes, ma'am.
Okay. Also, Brandon, talking about the dashboard, because, you know, we've had a lot of parents and concerned people wanting to see our numbers, and I am in complete agreement with other board members on this, that I want us to be as completely transparent as possible, but I also want the numbers to be accurate, what we put out there, and only reflect those numbers that are coming from the school setting, and so that it doesn't look like we actually have more coming from the school setting than we actually do. Is that also something that we need to revisit, or is that something that we can work on getting out there?
Madam Chair, I believe that directive has been given to the administration unless
Okay.
I don't see that as necessitating a board vote. I do think that is a consensus determination.
Are we all in consensus on that? Do we all agree, other board members? I just want to make sure we're clear on that.
Madam Chair, this is Mr. George. That's what I'd like to see, yes.
Ms. Burns?
Yes, I agree. That's something we need to do.
Okay, Mr. Hall?
Yep, same thing.
Mr. Smith?
Yes, I support transparency of it.
Okay. All right. Are there any, okay, so, Dr. Blumenwright, I guess you heard that, correct?
Yes, ma'am.
All right. Thank you, sir. And thank you for all the hard work. I know this has been a process, but we just want to make sure it's right and that we're getting the right information out there.
Yes, ma'am.
Do we have anything else that we need to share? Anything else from the health department? Any questions for the health department? They've been really gracious to come meet with us today on this. Anything else for Dr. Blumenwright, Dr. Hill, Mr. Taylor, I know is here. Okay. So if we're good, at this time we can move into the action agenda.
How about the parents?
And
How about parents? Can they have a say-so? Can parents have a say-so?
I'm sorry, I don't know who that is. I can't.
My name's Patricia Kolich. I came to the meeting.
Hey, I'm sorry, but this time due to general statute, we do not have public comments at this time. Next Tuesday night, absolutely. But
You're making big decisions on our personal lives, tracing, masking, vaccinations, and you won't take my opinion on what I need to say about the PCR test?
Ms. Kalush, next week.
We have every right to say something. Every right.
Ms. Kalush, and we want to hear that. It's not that we don't want to hear it, but at this time, not
PCR
this
tests are not
meeting.
working, but you're gonna trace the numbers and make decisions on PCR tests that don't work? And they're gonna be replaced as of December according to CDC? You haven't even read the bars on the CDC report for vaccinations?
Madam Chair, I make a motion to approve the HR report.
I do too. Thank you. Mr. George has made the motion. Do we have a second?
I'll second.
Ms. Burns is seconded. All in favor, Mr. Hall?
Yes.
I hope you all
Mr.
get
Smith?
fired shortly.
Mr. Smith?
Evil people, very evil. Evil people.
Ms. Burns again?
Yes.
And Mr. George? So
Yes.
moved. At this time, we now need a motion to adjourn this meeting.
No, we have comment from the board members.
Oh, that's right. Sorry, it's not on this agenda. Go ahead, Mr. Burns. Mr. George, I'm sorry.
First off, I'd like to say thank you to Dr. Hill and Sheriff Cutler. They did a nice video that I've seen this morning on bus safety and not passing a stop school bus. Thank you for that. Also, I'd like to propose another call-in special meeting to discuss this on September 21st, which will be 2 weeks from today at 9 a.m., if that will be possible.
Board members? I'm fine with it. I agree that we probably need to keep meeting until,
This is Beth Burns. I have no problem with that. I agree.
What was the time again? 9 a.m.
Yeah, I want to make sure that's heard too. September 21st, 9 o'clock a.m.
September 21st, 9 a.m. Sounds good. Mr. Smith, are you guys okay with that?
Follow me. It's fine.
All right. Mr. Hall, do you have any comments that you would like to make at this time?
No.
Mr. Smith?
No.
Ms. Burns?
No, ma'am.
I would just like to follow up and just add again that I want everyone to understand that we do understand that there is so much time and effort from everybody. I'm talking everybody that's employed by the school system, the health department, and we want you to know that we do notice what you guys are doing. We notice what you're doing after hours, and we're doing everything in our power to help get you guys some help if at all possible. So thank you all to a job well done. And to everyone who's called in or has emailed us, yes, we are seeing them. We may not get back to everyone, but we are seeing your emails, and we are seeing the concerns on both sides of the coin. So just wanted to say thank you to everyone. At this time, do we have a motion to adjourn the meeting?
I'll make a motion to adjourn, Madam Chair. This is Mr. George.
Mr. George made the motion. Do we have a second?
I'll second.
Ms. Burns is seconding. All in favor? Mr. Smith?
Yes.
Mr. Hall?
Yes.
Mr. George?
Yes.
Ms. Burns?
Yes.
So moved. Meeting adjourned.